substance misuse can actually both predispose and perpetuate mood disorder, which means that it can actually lead to the development of mood disorder, and it can actually make the existing mood disorder worse. Hi, my name is Dr. Memoona Usman. I'm working as a consultant psychiatrist in General Adult Mental Health Service in the Midlands region. I have completed my 8 years of specialist training in psychiatry from the College of Psychiatrists of Ireland. I have completed a master's in clinical education, and I'm currently doing a master's in leadership in healthcare. So mood disorders are mental health conditions in which there is some abnormality with the mood. We all experience certain abnormalities with mood time to time. For example, it is common for any one of us to be sad or to feel depressed after some unforeseen event in our life. But if the feelings of sadness is persistent and is disproportionately severe compared to the normal day-to-day sadness, then this is something that warrants more investigation and treatment. There are some common signs that are very evident in someone who develops a mood disorder. The primary abnormality is with the mood, that the mood can be persistently depressed most part of the day, most days of the week, for at least 2 weeks. So if it crosses the threshold for 2 weeks, then we call that as a major depression. Other than the mood, the patients may experience some abnormalities with their energy level, that they may be tired, they may lose their appetite or sleep, they may lose weight, and in certain atypical cases, they can actually gain weight because of comfort eating. They may have negative thoughts about feeling worthless about themselves, about excessive shame and guilt, about blaming themselves. Sometimes people with mood disorder, when they are depressed, they have the thoughts that their life isn't worth living. And other times they may have thoughts about not being around anymore, or they wish that they wake up dead, or they be in some other place, like other than this world. So we call this as a passive death wish. But other times they may have thoughts to harm themselves actively, and this come on the foot of these thoughts that they are worthless, or they may place excessive shame and guilt and blame for some very trivial incident, and they believe that the world would be better out without them. So the mood disorders may actually predispose to the suicidal risk, and this can be managed with the medication and with other treatments that are offered by the community mental health teams or by their other professional teams. While genetics may play some part in the development of mood disorders, but our lifestyle choices play a huge role. For example, unhealthy lifestyle, if the eating habits aren't good, if they don't do physical activity or exercise, if the sleep is an issue, or stress. So all these factors can actually predispose to mood disorders. But more importantly, substance misuse can actually both predispose and perpetuate mood disorder, which means that it can actually lead to the development of mood disorder, and it can actually make the existing mood disorder worse. The symptoms of mood disorders can actually mimic many other conditions, and it's important for the patients to have the correct diagnosis so that they don't have unrealistic expectation with the treatment. For example, someone with anxiety disorder may experience some abnormalities with mood, in that they may feel depressed because they are so anxious. Or the people with bipolar affective disorder, in which they experience periods of depression with periods of elation. These symptoms may mimic some other emotional disorder, which we call as emotionally unstable personality disorder, in which people may feel fine for a few days and then they may feel low for another few days. And a lot of these patients, they are either misdiagnosed as bipolar disorder in different services, or else because of the social media, they believe that they have a bipolar disorder, and they come to service with the expectation of getting treatment, which is usually prescribed for bipolar affective disorder, but doesn't work for, say, emotionally unstable personality disorder. It's very important that in the mood disorder, if the symptoms of depression are actually present to a certain degree and it crosses the threshold, say for example 2 weeks for major depression, then it qualifies as a mental disorder or as a major depressive disorder. If the symptoms are intermittent, which means that they just come and go, then they may mimic as depression, but this is not a depressive disorder, and this could be for a variety of reasons. A mood disorder is considered a mental illness, which means that there is like a pharmacological treatment and a psychological treatment for that. Pharmacological treatment include antidepressants, and mood disorder actually respond very well to like different antidepressants. We have a variety of options for that. The problem arises when someone with emotionally unstable personality disorder who may come to you and say, oh, I have been depressed all my life. And when you actually start to dig into the depressive symptom, it seems that they may have some symptoms of depression here and there, maybe a few days. They're fine in the morning, but depressed in the evening, or they're fine for 4 days, but depressed for 7 days. And they feel, and they'll tell you, and if you tell them you don't have a depressive illness, they actually get confused. Sometimes they may become upset, or they may become irritable because they have this expectation of receiving treatment. They have this expectation that the medications are going to work for them, which unfortunately don't in that circumstances. So that's why a correct diagnosis is very important, and that's why linking in with the mental health service or the professional guidance is vital in this case.